Doesn't take much. What we talk about? Bear with me just for a second because we're going to have another. I'm using 2 cameras today, and I'm trying to figure out how I'm going to use the other one and toggle between them. Yeah. And I've gotten better with technology, but I'm not perfect at it. So I'm not sure what we have to do. Oh, I see. Bear with me just for a second here. Aha, okay. Well, that was easy. Okay. So like I told you, I have some hearts to dissect. I have one that I purchased probably about the beginning of the year or somewhere middle of last semester. When I learned that I was teaching this class. And so it's a pig heart that's been fixed in formaldehyde. And then at the beginning of the semester, I looked up a contact I had for a butcher out of East Berlin, Pennsylvania, and got a bunch of unfixed organs. Because as I've learned over the last little while, over the last year, dissecting unfixed organs versus fixed organs is very, very different. And they have a different texture to them. And what you see of a fixed organ that maybe possibly comes from a fixed cadaver is very different from what's actually really within people. And so I'm gonna try to do both today. But what I want to do is go through some heart anatomy. But actually, before I do that, I'm sorry, bear with me here. Before we do that, I want to look at the syllabus. I got an idea the other day about doing some additional case studies in lab. And if you look at where we are in lecture and where we are in lab, we won't finish the immune system for about another week. Well, we should finish it next week. But if you look at where we are in the syllabus, coming down here. The fun of this class that I don't have for my physiology classes that I teach at other schools is that I can really do whatever I want with it in a lot of ways. The class doesn't have a lot of uniformity with other professors for hack, which is a good and a bad thing. But one of the good things about it is I can really do whatever I want with the course. And so I was thinking about it because I was talking with a course coordinator that I have at Stevenson about the fact that I do give you case studies, but I essentially expect you to do them on your own. I expect you to apply what you know and do the information on your own. And one thing that I did last year when I taught the biology 122 lab is we took a day where we only looked at case studies. And I gave you the studies and asked them to read them in advance. And then we talked about them in class. And what I'm thinking about doing is doing that in here. You'll still have other case studies that I'm going to ask you to use all the information that you've learned and apply it. But doing some case studies in lab is fun because it gives everyone a chance to discuss them and apply what you're learning. And so what I'm thinking about doing is, because we're getting really ahead of ourselves in lab and we're not in parallel with lecture, is taking this cardiac cycle lab off and putting, what I would do, and let me zoom in on this. What I would do is take this virtual lab, because we're going to talk about ECGs today a little bit, and put it up into today's lab. And do case studies next week. And you'll have to be patient with me because this idea only came to me yesterday. And so I don't even have those case studies yet. And what it would probably be would be some complete blood counts and maybe some questions about ECGs, because we will talk about them today. And maybe some questions about the immune system and blood. And so rather than doing this lab exercise 28, do some case studies here instead. And move this virtual lab that's right here, that would be next week, and put it in with today and have it be to do next week. We're going to talk about ECGs today in the next 3 hours. Is this clear what I'm thinking about doing? So taking this lab off, just removing lab exercise 28 altogether. We won't do it. And instead doing case studies. And take this virtual lab right here and putting it into today. All I have to do is change it around and put it into today's stuff instead. And what I would ask you to do, and I'd have to figure out how to set this up, is ask you to answer some questions based on those case studies and submit those instead of a Wiley lab exercise. I might still get it from Wiley, but I'm not sure. I need to think about it a little bit. Is this making sense, what I'm asking and what I'm thinking about doing? Anyone have questions about it so far? I know some of you, I know Kevin specifically, looks at the due dates and uses the due dates off the syllabus, which is a good idea of what he needs to do and what's due. So rather than having the virtual lab next week, be assigned next week, having it assigned today. And I'll open it as soon as we're done with lab. And rather than having the Wiley lab exercise questions based on this lab exercise, doing case studies instead. And I will adjust the syllabus. I'll make some changes to it. This being the change. That have, rather than lab exercise 28, have it be case studies instead and discussing case studies. Because I feel like a lot of times with these online labs, I spend the whole time talking, which, you know, as much fun as it is to just sit there and listen to me talk, and I'm being sarcastic there, as fun as it is to just listen to me talk, doing some case studies would be better, or add some flavor to it and some variety. And the other thing is coming down here, because I really think there are some good case studies out there, rather than, maybe not, let me think about it. I may put them in another place also, but let me think about it. And take one of these labs out and do another set of case studies instead. But let me think about it. Is that clear? And does it make sense what I'm looking at? So rather than doing lab exercise 28 next week, giving you a set of case studies and discussing those case studies. And they'll have to do with blood, they'll have to do with immunity, they'll have to do with heart function, as we've covered it today, and ECGs, because we'll cover those today also. And rather than cover the cardiac cycle, which has a lot to do with the ECG, do it just in lecture. Okay. Let's move forward with today. So why do lab exercises? So what I want to do first is work through this PowerPoint, and you'll see that a lot of this PowerPoint, there's a lot of pictures. And it's a longer PowerPoint, but a lot of it will move through fairly fast because it's just different pictures of heart anatomy. I hope to work through it fairly fast because I want to spend more time actually doing the dissection, or spend a lot of time or relatively big time working through the dissection. So the heart, where it's positioned in the thoracic cage, and the area where it is within the mediastinum. One thing that I'm trying to do a lot, because this is an online class, and I do it in my face-to-face classes, because we don't spend a lot of time with cadavers, and models and diagrams are helpful, but they don't do it justice for what it really looks like a lot of times. And so I'm going to try as much as I can to keep pictures of cadaver pictures in here too. So this being the cadaver, this being your diagram. So here's the heart, and it's in what's called the mediastinum, which includes the heart and the major vessels coming off the heart. And remember, about right here would be where you'd find the thymus of the immune system. So it's nestled between two lungs, mostly in the area of the left lung. And it's within a sac. And the top layer of the sac is the fibrous pericardium. And if you look at it a little bit, you'll see it's kind of angled to the left. This is the apex down here. And the base is up here. And it's angled so that it's kind of like this, and it's leaning out, it's in, and then it's leaning out to the left, and the angle is a little bit closer to the surface of the chest than the base, because the base is up here. So looking at it in a cross section, and mind you, this diagram and this one from the cadaver are taken at slightly different levels. But here's the angle of it. Here's the apex of it, angled out towards the surface. Here's the right ventricle. Here's the left ventricle. And if you look at the left ventricle here, there's a lot more muscle around it. And we'll talk about the reason behind that here in a moment, but there's a lot more muscle. Here's the right ventricle. Here's the left ventricle. This cut right here is a little further up in a lot of ways. It's a little further up, and the right atrium is also being seen here. bear with me here. I'm gonna just for a moment. So looking at a basic diagram of the heart, looks like this. And we divide it into 4 quadrants or 4 chambers. The atria are up here. The 2 atria, the right and the left atria. And the ventricles are down here. The atria receive the blood from the body and the lungs, the right one from the body, the left one from the lungs. The right ventricle is going to pump it out to the lungs. The left ventricle is going to pump it out to the body. And I know you probably have questions, so bear with me. We're going to go into a lot more depth here in one moment. And it'll probably answer a lot of questions. So here's my left ventricle. Here's my right ventricle. Here's my right atrium. It's part of the liver. It's the lungs. It's the sternum. So it's kind of angled, so it almost is right immediately adjacent to the ribs. One thing you can see here is that fibrous pericardium. So this right here. Here's the fibrous pericardium right here. And there's a space in there called the pericardial cavity. So the function of the heart is that it generates blood pressure through alternate cycles of the heart wall contraction. When the heart contracts, it's called systole. And when it relaxes, it's diastole. And I like to think of it as this way. Systole is systole, and diastole is relax. And that's my way of remembering which is which, is that systole is and diastole is relax. You relax, diastole. So blood pressure is the force of the blood pushing against the walls of the vessels. And when we talk about blood pressure, which we'll spend a lot of time talking about when we go through talk specifically about blood vessels, the diastolic blood pressure is the blood pressure that's measured during heart relaxation. The systolic blood pressure is the blood pressure that's exerted during heart contraction. So this blood pressure is essential to circulate blood throughout the body. It carries blood, and arteries are going to carry blood away from the heart, and veins are going to carry it back. Something to keep in mind, that not all arteries carry red blood, which is oxygenated, and not all veins carry oxygen poor blood. A really good trick test question is to ask, describe arteries as being always carrying oxygenated blood. They're by definition, arteries carry blood away from the heart and veins bring it back. The pressure in arteries is, pressure in arteries is greater than the blood pressure in the veins because it's further distance, more distance is required to move it in the veins. Or wait, let me say it differently. The veins are further away from the heart if you think about the length of the blood vessels. And so the pressure is less in the veins. And to keep things moving in one direction and not have backflow, just like we saw in the lymphatics, to not have backflow, veins always have valves. So the heart functionally is two side-by-side pumps. These pumps work at the same rate and pump the same volume of blood. The right atrium and the right ventricle, one pump. The left atrium and the left ventricle, the other pump. The right pump directs the blood to the lungs. This is the pulmonary circulation. The left pump, which involves the left atrium and the left ventricle, pumps the blood to the body. This is systemic circulation. Let me actually mention one more thing because I think it's going to come up in your questions on Wiley. The amount of blood that gets pumped with each systolic contraction of the heart is what we call the stroke volume. Stroke volume. And while we're at this, let me define a few terms. So this is the volume of blood pumped by each ventricle, or I mean, we actually think of it as being the left ventricle because it's systemic circulation, but recognize that the same amount of blood being pumped by the right ventricle is equal to the amount of blood being pumped by the left ventricle. But stroke volume is the amount of blood or volume of blood. So measured in milliliters or liters, but often milliliters because it's rarely a liter of blood. Volume of blood being pumped by the left ventricle with each systolic contraction of the ventricle. So with each, actually, let's not even say, let's just say with each contraction. The cardiac output is the volume, the total volume of blood Total volume of blood. Pumped by the left ventricle per minute. So what this means is that cardiac output, and I'm gonna add some abbreviations here. Stroke volume is the volume of the stroke volume is one of the key factors for determining cardiac output. The only factor that's not here is the heart rate, which is the number of contractions. Heart rate. So it'll be really important later. So keep this in the back of your mind. And we will see it again. Heart rate, which is the number of systolic or contractions per minute. So ultimately, cardiac output equals stroke volume times heart rate. Do you see the relationship? I'm going to shift this just a little bit here. Control copy. So cardiac output equals the total volume of blood pumped by the left ventricle per minute. And you realize that this is the same for the right ventricle. But we think of this more as having to do with systemic circulation and not pulmonary. The stroke volume is the volume of blood being pumped by the left ventricle with each contraction, which is the same as the heart rate, or a heartbeat, aka heartbeat. And then the heart rate is the number of heartbeats per minute, or the number of contractions per minute. So coming back from this, will divergence. One pump directs the blood to the pulmonary circulation. So one cardiac output is going out to the pulmonary circulation. One cardiac output, the one of the left ventricle and the left atria, is going to the systemic circulation. So blood is flowing into the right side of the heart, into the right atrium, draining down into the right ventricles. Remember, blood is a liquid, so gravity works on it, and it's flowing from the right atrium into the right ventricles. And then it gets pumped into the lungs. And then it goes out to the lungs and enters back into the left side of the heart, where it drains into the left ventricle. And then from the left ventricle, it gets pumped out through the aorta to the systemic circulation on the rest of the body. And then it returns back via the right atrium. So pulmonary circulation is from the right, bear with me, from the right ventricles to the lungs and back to the left atrium. And systemic circulation is from the left ventricle aorta, the systemic tissues, and back to the right atrium. Questions about this? The pericardial sac and the layers of the heart muscle. First, the pericardial sac. So if you remember from biology 121, you remember the meninges, right, around the brain? Somebody say yes.
Yes.
Okay, you remember the meninges around the brain. And yes. If you remember, I described them as being a very tough, hard material that was hard to tear. Dura mater meaning it's very tough. Dura mater meaning heart, tough mother. The fibrous pericardium is like that. It's very, 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 very tough. At least the outer layer, the fiber, or let's actually just say the fibrous pericardium is very tough. The serous pericardium is the inner layer of the heart muscle, or it's actually the top layer of the heart. So remember, serous means wet. And there's two layers of the serous pericardium. It includes the parietal layer, which is right on top of the heart, and the visceral layer, which is right underneath. Remember, visceral means organ. So another way that we describe the visceral layer that's right on top of the heart and is actually part of the heart wall is we call it the epicardium. Think of cardium as being heart and epi as meaning on top. So we have three layers of the heart muscle. We have the epicardium, the endocardium, and the epicardium, the myocardium, which is in the middle, and the endocardium, which is the most inner layer. And then we have the outer pericardial sac is made of the parietal layer of the serous pericardium and the fibrous pericardium. And in between there is a sac called the pericardial cavity. Or in between them is a space called the pericardial cavity. Questions? You've heard of people getting fluid around the heart. I think some of you probably have. What does that mean? What that means is that there's fluid filling up the pericardial cavity. And we have some fluid there all the time because it helps with lubrication and resistance. But when it builds up, It's this sac like this, and mind you, I know this is blurry. This is the superior vena cava. This is the aortic arch. This is the brachiocephalic trunk, the left common carotid artery, left subclavian artery. I know it's blurry, but this was the best picture I could find online. So here's the fibrous pericardium. Here's the visceral pericardium. Remember, the visceral pericardium is right on top of the heart. Visceral meaning organ. Visceral pericardium is also called the epicardium. When there is fluid around the heart, or too much fluid around the heart, what it does is that it's filling up the pericardial cavity, which you can see here. Why would that cause the heart to struggle as a pump?
Because it can't pump. Like,
Why?
Because the fluid being there and it makes it like slow down.
Why does it slow down? Zena, why do you think it's slowing down?
Because it's fluid filled like there in that area, and that visceral area.
Yeah, if you think about it, have you ever tried to push against fluid? You've tried like being in a swimming pool, right?
Yeah.
And all of a sudden it's a lot harder to move.
Right.
It's the same thing here, except it's surrounding you completely.
This might be a little off topic, but can't that also result in like heart failure?
My mother says no.
Okay.
Why not, mother?
Or even like heart attack?
Or heart attack, mother?
That's different. That's a muscle.
That's a muscle thing.
Okay.
And a heart attack is actually you're working on the coronary circulation.
Okay.
That damages the muscle. So it can't pump as well as I'm saying all that my mother is saying here.
Congestive heart failure is fluid in the lungs and the heart pumps against it. And there's the heart.
Oh, okay. That's where I was lost at, just because that's
Did
what
you-
my grandmother had.
You know,
So
this is a great microphone. So you caught that? You heard what she said, Jade?
I did. I heard her. Yes.
Awesome. Okay.
Thank you.
You're welcome.
Can I ask a question to your mom on that note?
Go, Mom, come back.
I'm sorry.
She's good for this. She learned stuff as I learned stuff. We were just talking about bone anatomy a minute ago. Go. So ask your question.
Okay, so does the CHF happen because of the left or the right lung being filled?
I think it's the left.
Okay.
Well, the right heart is pumping to the lungs.
Right.
Okay. The left and the fluid builds up in the lungs because the left heart is failing.
Right.
And isn't pumping.
Right.
well.
That's why. Yep. So it's the
Okay.
left. And we will talk a lot about that. Bear with me. We will get to that in lecture.
All right, thank you.
And Zena, you're gonna bring that question up again then too.
Hopefully
Because
I'll remember.
Actually, we're kind of covering it right here. Can you understand why, Mom, come back. Can you understand why that would be the case? That it would be the left ventricle that's starting to fail? If it's not contracting as strongly, that the stuff is coming from the lungs.
Is backing up.
It's backing up in the lungs because the left ventricle is not getting it out into the body.
Yeah.
Kind of, Zena, does that work a little bit?
That makes sense. Yes.
And we'll talk more in 1 second about how the blood flows through the heart, and which will explain how it's moving through the lungs. But yeah, it's backing up into the lungs because the left ventricle is failing.
Okay, thank you.
You're welcome. So endocardium, looking at the heart muscle itself, the endocardium is the most inner layer. Think of, remember how the endo meaning the most inner layer, if you remember that from last semester, endo meaning the most inner layer. Myo, think of myo as being in the middle. And myo also means muscle. So myocardium meaning cardiac muscle. The epicardium, meaning the most outer layer of the muscle, which is also the visceral layer of the serous pericardium. Think of if it helps you to remember the pericardium, peri meaning around. One thing that we should mention here, if you remember, I mentioned it really quickly earlier this morning when we were talking about the leukocytes and the way they move through the blood vessel wall. The endothelium that lines the endocardium here is continuous with the endothelium that lines the inner blood vessels. And Zena, just FYI, this is all epithelial tissue. What we talked about in lab on 121. So this is all epithelial tissue because,
okay.
because epithelial tissue lines all body surfaces and all body cavities. And I don't know, I still think a lot of you that I know who had 121 with the guy who was a twit with you. I'm trying to be nice about some of the things I feel about him. I think he was, I'm not going to keep going on about him, but I think he was kind of a twit with you. Did he talk with you about tissues?
Yes.
Okay. Did you talk about connective tissue and epithelial tissue? Maybe not talk with you, but talk to you about
Hello?
epithelial tissue?
Sorry.
Did Claire, did he?
Internet connection was unstable. Are you talking about Professor Bacon?
No.
Are you locking
No,
up or
there
am I
was
locked?
there was another professor who was a twit. Joe Bacon was not a twit.
Yeah, no, I thought he was good. He was a little bit dismissive sometimes, but he's good. He was good. I mean, he's an instructor.
Well,
he seemed very
the other
knowledgeable.
121 lab instructor was kind of a twit with his students.
No, that's not
I know, tell me about it.
good.
But Jay, did he talk with you about tissues? Jade, I hope you're there. Kevin, did he talk with you about tissues? Of course, nobody's responding.
There was like a I don't know, I don't know if it was my computer or if everybody or yours, or I don't know, there was like a blip where like it got frozen for a second. So I don't know if anybody else is frozen as well.
All right, we'll just move forward and I'll ask that question later.
Okay.
But so we have
here. If you see me
Okay.
talking, I'm just talking to my dog.
I understand that kind of thing. So within the heart, we have the 4 chambers. We have the right atrium, we have the right ventricle, we have the left atrium and the left ventricle. And so here's our one pump that's working with that's going to supply the blood pressure for pulmonary circulation. Here's the other pump that's going to provide the blood pressure for systemic circulation. So looking at a real heart, and you can see why I don't think that the diagrams do justice here. Here's your right atrium. Here's your right ventricle. Here's the left atrium. And here's the left ventricle. In addition to the four chambers, there are also valves that allow for the unidirectional, so one directional blood flow without backflow occurring. So we have 4 different valves, and I'm gonna zoom in just a little bit here. The right atrioventricular, what atrial meaning, here's the atrium, here's the ventricle. And this valve, right atrioventricular, separates the atrium from the ventricle. It's a valve in between that. The pulmonary semilunar, here's the pulmonary trunk. And the pulmonary semilunar has 3 valves in it that look like semilunar moons going out to the lungs, pulmonary semilunar. If you look at this, this is blue, this is red. Tend to think of blue as being deoxygenated blood. This is being oxygenated. This is an artery. This is that exception that not all arteries carry oxygenated blood, because until it goes out to the lungs, it's not going to get oxygenated. The left atrioventricular valve separates the left atrium from the right, from the left ventricle. And then the last, and this is also called the mitral valve or the bicuspid valve. Mitral, because if you're Catholic and you know what a mitral's hat looks like, this tends to look like a mitral's hat. The other thing that we call these 2 valves, this is the tricuspid valve because it's got 3 cusps. This is the bicuspid valve because it's got 2 cusps. And the best way to remember that the tri is on the right and the bi is on the left is try before you buy. So let me put that here for people who are having internet connection issues. Tri. Tri is tricuspid valve, or the right try before you buy. Bicuspid valve. So the tricuspid valve, the bicuspid valve. So the right atrioventricular separates the right atrium from the right ventricle. The pulmonary semilunar valve is in the base of the pulmonary trunk, and it's going to prevent backflow back into the right ventricle. This valve, the tricuspid valve, prevents backflow into the right atrium. When the blood comes back in from the lungs back into the left atrium, it's going to flow down the left atrioventricular, or the bicuspid valve. And then the ventricles are going to contract, and the blood is going to leave via the aorta. And to prevent backflow back when the heart relaxes, this valve is going to close. The aortic semilunar valve. So 4 valves. The right atrioventricular valve prevents backflow of blood into the right atrium when the ventricles contract. The pulmonary semilunar valve prevents backflow of blood into the right ventricle when the ventricles contract. The left atrioventricular valve is going to prevent backflow of blood into the left atrium when the ventricles contract. And the aortic semilunar valve is going to prevent backflow of blood into the left ventricle when ventricles relax. Now, looking at the base of the heart, remember that the base of the heart is right here, approximately. Looking at it right here, these are the valves. Here's the tricuspid valve. Remember, that's on your left. Here's the that's on your right. Here's the bicuspid valve, which is on your left. There's a pulmonary valve going out to this, being a cross section through the pulmonary trunk. And here's the aortic valve, the aortic semilunar valve, coming out through the aorta. Any questions so far? So some more pictures of these valves. And this is flipping this around, because now these are down towards the bottom. So here's the tricuspid valve. Here's the bicuspid valve, or the mitral valve. Here's the aortic semilunar valve and the pulmonary valve. Here's another picture of one of the semilunar valves. I'm guessing, looking at all the perfect shape of this is probably the aortic valve. Perfect shape of this artery. This is actually looking at a cusp. Actually, this right up here, this would be the cusp up here of one of the mitral, either the mitral or the bicuspid or the tricuspid valve. And these little tendinous cords are going to, hold down the valves of the heart onto the walls of the ventricle. The papillary muscles that were on that picture are right here. You think papillary meaning nipply. Papillary muscles. So looking at blood flow through the heart. Blood enters the right atrium from the superior vena cava. Here's the right, let me orient really quick. Here's the right atrium. Here's the left atrium. Here's the right ventricle. Here's the left ventricle. Here's the pulmonary trunk. Here's that pulmonary semilunar valve. And right underneath here, deep to this, going out like this, would be the aortic semilunar valve and the aorta. Here's the tricuspid valve. Here's the bicuspid valve. So blood enters the right atrium from the superior and inferior vena cava. It also comes in what's called the coronary sinus, which we'll talk about in a moment. Bear with me here. Coronary sinus. Which is part of the coronary circulation, so the blood flow specifically to the heart muscle to allow it to contract rather than going out to the body. I think the weather is making it hard for a lot of people to get good internet service today. So the blood enters the right atrium from the superior and inferior vena cava. And just because of gravity, the blood in the right atrium flows into the right ventricle.
Hey, I have a question.
Go for it, Lauren.
This, like, I don't know if it's just me, but this is like really confusing. So if you're able to upload the recording to D2L,
I always do.
I would really appreciate that.
Lauren, I always do it. Do you know where to find them?
I can figure it out. If not, I'll let you know.
Here, let me just show you really quick, and then we can get back into it. I always do. I know it's confusing because we're ahead. And so bear with me just for a second here.
And the heart is, don't you think the heart is one of the hardest to learn?
Honestly, I think the immune system is harder.
Well,
Personally, once you get the rhythm of the heart, it's not as hard.
Yeah.
My bio professor
pun
last
intended.
semester said that A&P1 was harder, but I think A&P2 is harder, honestly.
I think personally, I think AMP2 is,
AMP1 is harder.
you think it's harder?
Yeah, I think
I
just 'cause you have a lot with like the cells and like atoms and like a lot more, I feel like.
It was more a lot of definitions. This is
Okay.
more steps.
Okay. I personally, I think this might be harder, but I think it's more fun. I think it's more interesting. It's taking all that hard stuff that Jade had to learn last semester and applying it to real situation and making it, you spent all that time studying atoms. What does that have to do with anything? And so I don't know, but I honestly think the immune system is harder. I think the nervous system is hard. But I think by far, I think the immune system and the urinary system are probably the harder parts. But let me show you where those recorded lectures are. right here. Do you see it? Lauren?
Yep. Yep.
And a lot of times anatomy is harder because it's a different mindset of thinking. It's a lot more memorization and less mentally putting a process together. Oh, don't do that, Mary. So blood, and you know, and you can probably ask Zena at the end of the semester which one's harder because she's taking them both right now. 121 and 122, and she's not here with us. I can see she's got her camera on and there's nobody there. So we can ask her at the end of the semester what she thinks is harder. So blood enters the right atrium via the superior and inferior vena cava. Because it's a fluid, it flows. So it flows down just based on gravity. A lot of it flows down from the right atrium into the right ventricles. And once it's in the right ventricles, the ventricle is going to contract and it's going to move out through the pulmonary trunk towards the lungs on both sides. The blood is going to go out to the right and left pulmonary arteries and enter the lungs. And once it's done in the lungs, it's going to return from the lungs via the pulmonary veins. They're right here. Into the left atrium. And the blood within the left atrium, just like it did with the right atrium and the right ventricle, is going to flow down into the left ventricle. And from the left ventricle, when it contracts, it's going to go out through the aorta. Then afterwards, once it's gone out to all the systemic tissues, wherever, it's going to come back through the superior and the inferior vena cava into the right atrium. What I also think, one thing that makes this a little bit more challenging, and it depends on how your head thinks sometimes, how your mind thinks. This is more, it's more a process, and it's also more visualizing how it's going to happen and how it's going to flow. Any questions right now? bear with me, let me figure out where I'm starting. So systemic veins bring the blood in by the superior and inferior vena cava into the right atrium. From the right atrium, it's going to flow through the right atrioventricular valve or the tricuspid valve into the right ventricle. From the right ventricle, it's going to move through the pulmonary semilunar valve into the pulmonary trunk and arteries. Where there's going to be gas exchange in the lungs. Then the blood enters the pulmonary veins, which drain into the left atrium. The blood flows through the left atrioventricular valve into the left ventricle. From the left ventricle, when that ventricle contracts, the blood is going to move out via the aortic semilunar valve. And into the aorta and out to the systemic arteries, where gas and nutrient exchange is going to occur in the peripheral tissues. And back to the systemic veins. One thing that you'll see about this PowerPoint is because I know there's a lot of details here, I'm giving you a lot of pictures for a reason. Lots and lots of pictures. During contraction of the heart, the bicuspid and tricuspid valves close systole. This is a diagram, this is an actual heart. And I know this is kind of blurry, but it's the only picture I could find that showed this like this. During diastole, when the heart is relaxing, the bicuspid and tricuspid valves are open, and the pulmonary and aortic semilunar valves are closed. So moving on, that was the blood flow through the heart. Moving on, gonna look at the surface anatomy of the heart. The way that I always can see decide what the front and the back of a heart is I look for these two things right here. These are the auricles. What does an auricle mean? You've heard that word before in 121, maybe once. And you might have heard it other places. What's an auricle? What's an auricle?
An ear, like
It's the ear. Yeah, that's right. It's the ear.
for some
And-
reason I kept hearing Oracle, like the company. Oh,
Oh.
like, and then all of a sudden I'm like, you're saying Oracle like as an ear. I'm like, what is she? I'm like, nothing's ringing a bell. Oh,
I
yeah.
understand. Oracle, so oracle meaning the ears. So these are the ears of the heart. And if you think about your ears, do they fold backward or fold forward?
Backwards.
No. Look at how they fold. Do they fold backwards or forwards?
My ears?
Yeah, how do they fold?
Oh, if you fold them forward.
Well,
No.
don't fold them. How do they fold? How does this little thing fold?
Oh,
Does it-
I see what you're saying.
Okay,
Forwards.
it
Oh
folds
my
forward.
God.
He's like, well, if you fold, I'm like, don't fold them. All
I
right.
see what you're saying. Yeah, that
All
part.
right. The way that I can tell the front of the heart from the back of the heart is that the auricles fold forward. They're going to fold over like this. They're going to fold over like this. And you'll see that when I pull the heart out of the bags here. And that tells me that this is the anterior side of the heart. Auricles are an extension of the right and left atrium. They don't really have a lot of purpose outside of that we know of. These are just extensions of it. The apex right here, base about right there. The left ventricle is a major part of the apex. And the right ventricle right here. The right atrium and the left atrium. Mom, do you want to take her with you? Mom, can you take her with you? Okay, when you're ready, because I'm going to be doing the dissection. Some other things on the front of the heart. If you saw back here, we'll see it again in a second. In between the ventricles, we have this interventricular sulcus, meaning a dividing point. Or actually, let me call it this, interventricular septum. Just like the septum in your nose, it's dividing the right and the left. Right here, we have the atrioventricular sulcus. If you think about it, or interventricular sulcus, meaning it's the sulcus that is going to be connected to the septum that's going to separate the two ventricles. And within that sulcus is the anterior interventricular artery. So anterior interventricular sulcus is an anterior interventricular artery. There's a great cardiac vein that runs with it. Every time when you have arteries, most often you have veins running with them. This is the biggest artery of the heart, this anterior interventricular artery. So the great cardiac vein runs with it because it's the biggest vein. Wherever you take blood out to in these tissues, you have to bring it back. Right here, that's going to wrap around the heart is what the circumflex artery. Think of a circumference of a circle. This is going to wrap around the base of the heart. Looking at this other side, right here, and we haven't talked, I should have mentioned this before. So right underneath here that you don't see, but it's the left coronary artery. And it is what is going to become the anterior interventricular artery and the circumflex artery. The right coronary artery, which is going to come off right here off the base of the aorta, is going to become the marginal artery. Or is it marginal artery? and the small cardiac vein runs with it. Few other things to mention here. This little connection right here between the pulmonary trunk and the aorta is what's called the ligamentum arteriosum. In a developing embryo fetus, this is an open spot that can, where blood can flow between the pulmonary trunk and the aorta. After birth, it's just a connection tissue that connects the aortic arch to the pulmonary trunk. This is just another picture depicting the same thing on a model of what was here. Questions? This is looking at a cadaver and a really nice dissection of the arteries and veins on the front of the heart. I can tell you, I've never seen a dissection that looked that good. So here's that anterior interventricular artery. Actually, bear with me here. Yeah, anterior interventricular artery. This would be maybe the vein. The right coronary artery, the left coronary artery, the atrium, pulmonary trunk, the ascending aorta. Questions? I'm not going to go through all of these. I'm giving you a lot of pictures because, like Lauren said, this is not easy material. And one thing you have to do is you just have to keep practicing with it and looking at it. And it slowly becomes more and more familiar to you. Looking at the external, at posterior surface of the heart. Right here, so we're looking at the back now. So we flipped it. Here's the right atrium. Here's the left atrium. Here's the inferior vena cava. Here's the superior vena cava. On the very back here, along the posterior interventricular sulcus, is the posterior interventricular artery. And next to the anterior interventricular artery, which is the biggest artery, the middle cardiac vein is in the middle between the great cardiac vein and the small cardiac vein. And it runs with the posterior interventricular artery because that's the middle artery for size. And that'll make more sense in a moment. That didn't really make sense. But anterior interventricular artery runs with the great cardiac vein because it's the biggest and it runs with the biggest vein. The posterior interventricular artery runs with the middle cardiac vein because it's the second biggest. The right marginal artery is the third biggest, and the last one, and it runs with the small cardiac vein. right here, this area right here, where the anterior, excuse me, the great cardiac vein, middle cardiac vein, and the right, or the small cardiac vein, all of the veins of the heart, coronary circulation, are going to drain into right here, into the coronary sinus, which is going to drain into the right atrium. Here's your pulmonary veins coming into the heart, into the right left atrium. Questions? So here's a picture of just a model. So here's the left atrium. Here's the inferior vena cava. Here's the coronary sinus. Here's the middle cardiac vein. Great cardiac vein would be over here. Looking at a real heart. Here's the posterior interventricular sulcus. And within here is the posterior interventricular artery, which runs with the middle cardiac vein. The coronary sinus is about right here. The right coronary artery is about right here, right, runs around the base. And the small cardiac vein right here, run right down here. What else? This would be the right ventricle. This would be the left ventricle. This would be your base. Questions? What I really want you to do is spend a lot of time going back and forth with these pictures. I'm providing a lot of pictures. Go back and forth between the pictures. And it will slowly become clearer to you where everything is, and you'll see the patterns. So here's the anterior surface. Here's the auricles that are folding forward. Here's the right ventricle. Here's the left ventricle. And up here would be the right atrium and the left atrium. On the posterior surface, here's the right ventricle. Here's the left ventricle. looking at the internal anatomy. Sorry, bear with me. Looking at the internal anatomy. The right atrium has the inferior vena cava, the superior vena cava, the coronary sinus, and this little area right here, this little indentation is the fossa ovalis. So this is all within the right atrium. Opening for the superior vena cava, opening for the inferior vena cava, and the coronary sinus. Those are the three things that are going to drain blood into the right atrium. Here's the tricuspid valve, which is attached to the walls of the right ventricle via these chordae tendineae. Chordae tendineae meaning heartstrings that are attached to the wall via papillary muscles. This right here, this little thing right here, this would be the atrial septum, separating the two septum. Excuse me, separating the two atria. The interatrial septum right here, separating the two atria. This is your interventricular septum, separating the right ventricle from the left ventricle. The chordae tendineae of the bicuspid. And the papillary muscles holding it down. Questions? So here's another, this is essentially showing the same thing for the most part, except for this right here. Here's your tricuspid valve. Here's the bicuspid valve. This would be where the right atrium is. Here's where the left atrium is. Here's the left ventricle, the right ventricle. The left pulmonary veins. Okay, you guys are being really quiet.
I'm here.
Okay,
I'm here. I'm teaching my nephew, yeah, to stay home today. So I'm listening to you and helping him online.
I understand. So another picture of the diagram. Here's the right ventricle, the left ventricle. This is showing a cut into the pulmonary trunk and the valve, pulmonary semilunar valve. Here's the right atrium. The left atrium would be over here. Chordae tendineae holding down the tricusps of the tricuspid valve onto the walls of the papillary of the right ventricle via the papillary muscles. One thing that you see here on the inside the ventricles is you see what are called trabeculae carnae. You'll see those when we dissect the heart here. They look like little bars. Trabeculae carne meaning, and you've heard the word trabeculae before. We saw it when we were talking about the histology of the lymphoid organs. And you saw it when you were looking at the bone last semester in 121. Little bars. Trabeculae carne means little bars of flesh. Another picture. So showing specifically some things in the right atrium, which includes the pectinate muscles, the fossa ovalis, the opening for the inferior vena cava. Opening for the superior vena cava would be up here because that's the superior vena cava. So the right atrium is going to receive blood, venous blood, from the superior vena cava, the inferior vena cava, and the coronary sinus. Separating the right atrium from the right ventricle is the right atrioventricular valve. One thing that are really important later, when we talk about the electrical conduction system, is the sinoatrial node and the atrioventricular node. These are those pectinate muscles. So with this right here, looking at the right atrium, the sinoatrial node, the atrioventricular node. So they're involved in the electrical conduction that is going to stimulate muscle heart contraction. Right here's the, well, let's just switch places. Here's the superior vena cava. Here's the opening right there. Here's the coronary, the fossa ovalis, coronary sinus. And right here is the opening of the inferior vena cava. Here's these specifically, this is looking at the pectinate muscles of the right atrium with the crista terminalis, which is going to separate the pectinate muscles from the rest of the right atrium. And I think that the sinoatrial node, looking at this and knowing that it's near where the superior vena cava enters the right atrium, would be about right here. So shifting gears again. The white is a little hard to see, and I understand that. Here's the right ventricle. Here's the trabeculae carne. Here's the three cusps of the tricuspid valve. Here's the opening of the coronary sinus in the right atrium. The left atrium is going to receive the oxygenated blood from the lungs that's going to drain into the pulmonary veins to the left atrium. The left atrium and the left ventricle are separated by a left atrioventricular valve, also referred to as the bicuspid or mitral valve. The left atrioventricular valve is forced shut when the left ventricle contracts. Remember, it's one that closes during systole, which is contraction of the heart. The left ventricle pumps blood to the entire body except for the lungs, and therefore has to generate a great deal of force. At the superior end or roof of the left ventricle is the aortic semilunar valve, which marks the end of the left ventricle and the beginning of the aorta.
You gotta read it.
Yeah.
Okay.
So the first picture you saw was looking specifically at the right atrium and the right ventricle, this right here. This is looking more specifically at the left ventricle, left part. Trochleae, tendonae, papillary muscles. Up here, right now, actually, don't really see it here. We're just looking at the left ventricle. And up through here would be the aorta. So here's a model depicting almost the same thing, kind of. Here's the left ventricle. Here's the left atrium. Here's the mitral or bicuspid valve, or we also remember we call that the left atrioventricular valve. And it is separating the left atrium from the left ventricle. It says, but you still love me, even if I'm smelly. Questions? Probably lots. Spend some time looking at these pictures, and it will become clearer and clearer what you're looking at.
I think we kind of touched this last semester.
Did we?
No, I think in lab or something. I don't know. Maybe my mind's playing tricks on me, but I could swear.
So looking at the certain specific parts of the left atrium and left ventricle, here's your left pulmonary veins coming into the left atrium. Here's the mitral valve that separates the left atrium from the left ventricle. And the pulmonary trunk. Here's the right ventricle, the tricuspid valve. It's the interventricular septum. Typically, because the left ventricle has to pump a lot more circulation and has to pump out and generate enough pressure to push the blood through the systemic circulation. It is about 3 times as thick of a muscle wall as the left ventricle is. Questions? So right and left, go ahead. Sorry.
Does HAC have a lab where you can go in a person and like attach these models and like really learn on them or no?
I think so. If you go, McGraw-Hill does. I don't know about Wiley.
I was gonna say I thought like the Wiley has like you can go and dissect and look at things and test yourself on
Hmm.
the anatomy.
Probably. I think they
look it up.
probably both have it.
I've seen it on Wiley.
So coronary circulation, the right and left coronary arteries, they travel within the coronary sulcus. So we have a lot of sulcuses. Remember, you saw this word. You saw this word when we were looking at the brain. Remember looking at sulci and gyri? So coronary arteries lie in the coronary sulcus of the heart. And they supply the heart wall muscle with oxygen and nutrients. They are the only arteries that are given off by the ascending aorta that are just superior to the aortic semilunar valve. We'll see those in 1 second, right here. Here's the ascending aorta. Casey, were you going to say something?
No.
Okay. Here's the ascending aorta. Here's the right coronary artery. Here's the left coronary artery. Here's the circumflex artery. Here's the anterior interventricular artery. Here's the right coronary artery, which is coming around and becoming the right marginal artery right here. And if it, as it loops around, it's also going to become the posterior interventricular artery. The best way that I can explain to you this coronary circulation is to remember that certain arteries run with certain veins. So look at this diagram right here. Right coronary artery, left coronary artery. Anterior interventricular artery, circumflex artery.
And this is from like the front, right?
Yes, anterior interventricular, so anterior meaning the front. The right coronary artery is going to branch off into the right marginal artery and the posterior interventricular artery. The left coronary artery branches off into the anterior interventricular artery and the circumflex artery. Think of circumflex as it goes around the circumference of the base of the heart. Remember that the base in the case of the heart is top. With regards to the venous blood return from the heart wall, the great cardiac vein runs with the anterior interventricular artery. The middle cardiac vein runs with the posterior interventricular artery. And the small cardiac vein runs with the marginal artery, the right marginal artery. And all of these veins drain into the coronary sinus, which drains into the right atrium. So here Great cardiac, if you look back, scroll back, this diagram right here. Look at this, and you can almost overlap them. And this, here's the great cardiac vein, and the anterior interventricular artery would run with it here. The middle cardiac vein back here, and the posterior interventricular artery is going to run with it right here. The right marginal artery is going to run right down here with the small cardiac vein. Questions? So last part of this, talking about heart muscle and the electrical conduction. Cardiac muscle fibers contract as a single unit because they're all connected with low resistant cell-to-cell junctions called gap junctions. Gap junctions comprise the intercalated discs that are shared by cardiac muscle fibers. Therefore, an electrical impulse can be distributed immediately and spontaneously throughout the myocardium. So, Zena, you remember when we talked about gap junctions the other night in 121? Maybe? Kind of all a blur. She's like, nope, don't remember. These allow for cellular communication and allow for individual cardiac muscles to communicate with one another, allowing all of the muscle fibers to contract at one time and relax at one time. They're little tunnels that connect the cells. Looking at heart muscle, here's where the gap junctions are. It's like skeletal muscle in that it's got striations in it. But specifically at the intercalated disc, we have gap junctions to allow all of the muscle to contract as one unit and relax as one unit.
Is that where you say the sodium exchange happens?
Yes, that's where, yeah. So it's not a complete blur for you, Zena. I'm grateful to know that. Yes, that's where that's going to occur. So here's looking at the histology here, here's the intercalated disc. This is where the gap junctions are located. If you look, and it's kind of blurry, I know, but you can see the striations in the muscle. And later, Zena, in 121, we'll talk specifically about those striations.
Okay.
And last part of this is one of the neat things about the heart is it exhibits its own autorhythmicity, which means that it's capable of initiating its own heartbeat independent of external nerves. I think smooth muscle has some autorhythmicity. The heart doesn't much better, which means that if you cut off all of the nerves cut from the heart, it will beat on its own for a little while. The electric, go ahead, I'm sorry.
And it's all electrical, right?
Yeah,
Which is
and
why
it's
they get a pacemaker.
and it's doing it without any electrical stimulation by the nervous system. The nervous system can slow it down or speed it up, but the heart by itself also has its own rhythm. So it initiates it independent. The nerves have some influence in that they can slow or speed up the rhythm. But the heart inherently will beat on its own at a certain rhythm too. If you've ever heard of it or seen it, people can be dead and their heart will continue to beat for a little while. And I don't want to tell you a story because I want to get into the dissection. I don't want to go off on another tangent. But it's capable of beating on its own for a very short time because of this autorhythmicity, which we'll talk about later in lecture. But so what that does is it independently can create an electrical impulse, independent of the nervous system. And so it initiates a heartbeat that comes from special cardiac muscle cells called the sinoatrial node right here, right next to the superior vena cava in the right atrium. This is also what we call the pacemaker of the heart. And so it sends an electrical impulse. And if you remember from 121, the way electrical impulses move, they move in a depolarization, repolarization. You remember that? Okay. So they depolarize and then they repolarize. So as the electrical impulse spreads from the sinoatrial node, it spreads across the atria, causing a depolarization that's going to be followed by a repolarization. And then it moves to what's called the atrioventricular node right here. And then it spreads down the interventricular septum into the Purkinje fibers on both sides. And as that depolarization spreads, just like we saw with an action potential on the nervous system, it's going to be followed by a repolarization. So impulses from the sinoatrial node travel via gap junctions to the left atrium and the atrioventricular node. The impulse then leaves the atrioventricular node and moves down this atrioventricular bundle here, or the bundle of His. Once within the septum, the atrioventricular bundle is going to divide into the right and left bundles. These bundles pass the impulse to the conduction cells called the Purkinje fibers that begin at the apex of the heart. So these are the Purkinje fibers right here. And the Purkinje fibers are going to spread the impulse superiorly from the apex down here up the walls of the ventricles. So just a reiteration here. Muscle impulse generated by the sinoatrial node. It spreads through the atria and the atrioventricular node via an internodal pathway, meaning in between the two nodes, internodal pathway. The atrioventricular node cells delay the impulse as it passes to the atrioventricular bundle. So realize this pathway, this is the depolarization, which immediately is followed by a repolarization. Just like we saw when we looked at action potentials in neurons. The atrioventricular bundle of His conducts that impulse into the interventricular septum. And within the interventricular septum, the left and right bundles split from the atrioventricular bundle and start to move up the Purkinje fibers. So here's those bundle branches and the Purkinje fibers. So sinoatrial node, internodal pathway to the atrioventricular bundle. From the atrioventricular bundle, it's going to enter the interventricular, the atrioventricular bundle, or the bundle of His, and then down the right and left bundle branches, and then to the Purkinje fibers. So sinoatrial node generates an impulse. Remember, this is a depolarization, just like we saw with the action potentials. So depolarization spreads throughout the atria. If you're looking at an ECG, there's 3 different parts. There's a P wave right here. There's a Q, R, S, T wave. The P wave is atrial depolarization. This area right here, where it's depolarizing. This QRS complex is the ventricular depolarization. So this right here. And this right here is going to be the repolarization followed by the ventricular depolarization. The reason we don't see the repolarization of the atria is because it gets lost in this peak. So P wave, P, Q, R, S, T. The P wave is atrial depolarization. The QRS wave, this right here, is ventricular depolarization. The T wave here is ventricular repolarization. So looking at this, and we start right here. Bear with me. SA node fires causing a ventricular atrial depolarization, which is going to be where the P wave is going to be. P wave, depolarization. Then it spreads down the interventricular septum. And then up the Purkinje fibers, resulting in ventricular depolarization. And then repolarization of the ventricles is a T wave. You guys, I'm going to actually stop this right here. Do you have questions for me? So the ECG is essentially an electrical recording showing the electrical conduction, the depolarization and the repolarization of the atria and the ventricles.
When does class end?
It ends in about 40 minutes, but I want to
okay.
do a dissection.
Oh, okay, that's right. I was
Well-
like, it doesn't end now.
I know it doesn't, but I wanted to do a dissection. I don't think I'm going to be able to do both hearts, but I think I want to do the real heart. It'll be interesting what we see because I haven't done a dissection on the real heart. And have I ever done a dissection on the real heart? I don't know. It's
Can
not
I-
been fixed. What?
Can I say something? I think Zena was asking. If you go into the Wiley, there is like dissections of like real cadavers that you can like look at. Was someone asking?
Yeah, that was me. Thank you.
Yeah.
I'll look into it.
Yeah, if you go in and it's like, it's not the book part, but there's like something, I don't know, it's the second tab in and it like takes you through like a real cadaver.
Huh.
Wow. Okay, thank you.
All right. I'm going to stop here. And what I'm going to do, should I stop sharing my screen? Well, give me 1 second to figure this out.
Are you there? Sorry.
Yeah,
My internet goes in and out. I'm sure I was talking and like,
nope, you weren't. You actually did all right. There's no,
okay.
okay. So I'm
Thank
going to, I saw what I had to do before. Stop video. No, don't stop video. I want to do this. So give me 2 seconds while I get this set up. I'm gonna move my computer because I don't want to splash blood on my laptop. Gonna grab my lab coat. Well, we'll see how well this works. I probably need to put this so that I can see what I can see what you guys can see. And how good it is. No. You can kind of see I'm putting on a lab coat because I really don't want to get blood on my clothes. And I'm not going to do the fixed heart. That one will, I thought out the pig heart, so I have to do that first or it'll just go bad. The fixed ones can last for forever. So we'll do the fresh one. pull up my hair because I don't want to get blood in my hair. Let's see how well this works. Yeah, that's actually pretty good.
So I don't know if everybody else's screen is like this, but like I can see everyone. Is there like a way to put it just back on you, or am I the only one
Are
seeing?
you not, are you seeing the heart?
I am, but it's like really tiny.
Yes.
Like
Let's-
it's
let
like
me-
Brady Bunch style, like where all of us are on one screen.
Well,
It should be right under your leave, like when it says leave meeting, it should be right underneath it. It says switch to like active speaker, so it'll only be her showing. If that makes sense.
Okay, so I'm the only one seeing it that way. Okay,
Oh.
wait, speaker view. No.
say it one more time what you need
Okay,
to
now
do.
I got it. I
You
got it.
Okay,
Yep.
good. All right.
Okay, it must have
Okay.
been just me.
Well, it's probably just an adjustment that has to be made. Let me see here. What else do I need? I think I've got the most part what I need. I have a scalpel blade. I also decided that since I was doing dissections at home, I needed to invest in a probe, so I got a probe. I have some dissection pins. And I dropped one on the floor. All right. I'm gonna move this heart so it's not right there. Put it right here for right now. So this heart has been in a freezer, my freezer. So I got it from a butcher and I'm pretty sure it's pig. It's actually fairly small. So I'm pretty sure it's a pig. It's probably, I would honestly say it's about the same size as our hearts. And I've got someone in the waiting room. So give me 1 second. All right. Leo, you cannot, right? Not right now. My cat's busy pulling my leg. So pulling it out, and like I said, there are some major differences between fixed and non-fixed organs. And one of them is that they're just, the non-fixed organs are just a lot less stiff. Go like that because I don't want you to splash on my laptop. And you can see there's some blood clotting here. Now, how can I tell the front from the back? Here's my apex. Here's my base. And right here, as my cat pulls up my leg, right here is the left auricle. Do you see that?
Hey, your blood's pouring out.
That's all right. It's in a pen, so I'm not worried about it. But do you see the left auricle
Yes.
that I'm holding up here? And on this other side, actually, it looks like it probably got cut off. Oh, kind of. All right, kind of. Here's the right auricle. So right and left auricles. If they're folding forward, that means that I'm looking at the front of the heart. A lot of times with the main vessels that are coming in, if you stick your finger in them and follow where they go in the heart, you can figure out what they are. So right now, what I'm going to do is I'm going to make a standard cut, and I'm going to cut down here and down here on both sides. Oh, actually, let's wait just one more second here. Okay, if this is the front of my heart, right down the front here is the anterior interventricular artery. And it runs with the great cardiac vein. On this side, and it's not very well dissected out, but right here is would be where the right marginal artery was, running with the small cardiac vein. On the back here is where the posterior interventricular artery would be, running with the middle cardiac vein. And looking right in here, this little pillowy substance about right here, that's the coronary sinus. So now I'm going to make that cut. I'm gonna cut it right, try to cut it right down the middle. Oh, I wanted to show you something else. So when I was cleaning these up, I cleaned them up a little bit before I froze them. I just rinsed them off, just like you would meat. And I thought it was really, really quite cool, because when I was cleaning them out and trying to rinse them off a little bit, when I contracted them, when I put pressure right here, blood would leak out the bottom, and it's not really happening here. Well, kind of, but not very well. That's what they're essentially doing when people are talk about having to massage someone's heart when it stops beating, is they're essentially forcing the heart to contract and fill. So I'm going to start my cut right here. And I will tell you that you can actually, almost all of this stuff that I use came from a lot of it came from Walmart. The blade that I'm using is actually not an official scalpel blade, even though it looks like it is. It's an X-Acto blade, what you'd get in a craft shop. You can actually get them at Dollar General. Okay, let's see here. Come here. Let's cut that. So if you wanted to and you were God adventurous, you can get all of this stuff. You can go to a butcher, and for all the organs I got altogether, it cost me $28, which I can tell you buying my fixed organs costs a lot more than that. So look in here. Here's my right atria. See me, my left atria. Here's my right atria. My left ventricle, my right ventricle. Here's the atrioventricular septum. Or let me say this right. I'm not using the right word. Interventricular septum. Right here, if you look here, you can see the little strings here. So here's my right ventricle, left ventricle. You can see the little strings here. Those are the chordae tendineae that are holding down the bicuspid valve. And you can see that valve right up here. On this other side, here's the chordae tendineae. And here's the valve right here. These little bars right here, this stuff right here. This is the trabeculae carnae. If I stick my finger up into those two different, through the bicuspid and the tricuspid valves, I'm actually in the atria. My fingers are in the atria at that point. And actually, the way my fingers are right there, because of the, I'm trying to fill the, bear with me here, the interatrial septum. There's a little indentation on both sides when you're filling up those valves into the atria. There's a little indentation on both sides of the septum, separating the atria. That's the fossa ovalis. And what that is it's actually a flutter valve between the two atria during fetal development that closes off. And you probably, if you go back, you'll see it on the models, little indentation. I'm gonna do a little bit more cutting. want to see something because I think I found the aorta. Let's see here. Bear with me. Oh, I'm looking at the wrong side, right here. So, right here, here's going into the atria, the left atrium. Here's the left ventricle, left atria. On this other side right here, as I go up through here, and I stick my finger up through there, I'm in the aorta. Right there. And if I take a probe and I actually stick it through there, I'm on the other, I'm in the aorta. Right there, you can see the end of the probe. One thing that I should have stopped before I made all these cuts in here was here's the pulmonary trunk coming from the left ventricle. Here's the pulmonary trunk. If I make, let's see, I'm gonna cut a little bit right here. Right here, here's the pulmonary trunk. Right here is the aorta. This little connection right there is the ligamentum arteriosum. Casey, you feel like you look really tired. She's like, I'm just not going to respond. But that's the pulmonary trunk, the aorta. Was there a question? So I'm going to make, I want to see the valve of the aorta. And my mom isn't here. I'm gonna, what time is it? I've got a few minutes, Canoe. I'm gonna grab a pair of scissors because I don't, one hand, but I can use a pair of scissors. Okay. So I want to, looking at it again, orienting myself one more time. Here's the anterior surface of the heart. Here's the auricles that are folding forward. Here's the pulmonary trunk. So I'm going to remove just a little bit of this so I can see what I want to look at. What did I do? The fun thing about dealing with tissues that aren't fixed is actually, no, I'm looking at the posterior surface. I got myself confused because I'm like, what is this? This right here let's see here. This right here. This is the inferior vena cava right here that I've got my finger in. Because if I stick my finger in here, it's going into the right atrium. So a lot of times when you're doing dissections, whether they're fixed or not fixed, sometimes the best thing you can do is just stick your finger in there or your probe in there and see where it goes. So what was I going to do? I was going to look at the aorta. See here. Pull off some of this. So here I gotta get myself oriented again. Right here, coming in like right here, that's my aorta. Here's my pulmonary trunk. And I want to snip down down. Get rid of this. If you look right down, so I'm looking at the aorta here, and if you look right down there, right down there, are, all right, we're taking you off because I can't see in there. if you look right down there, do you see the valve down there? Do you see the valve?
Mhm.
Yes.
So that's a pulmonary, excuse me, that's a aortic semilunar valve. I kind of destroyed one of the cusps trying to get in there, but there's one valve. Excuse me, let me pull up this. There's one valve right there. There's a second one. And the third one would be over on this side. If you look right here, I kind of, because I couldn't get in there with the left atrium, the left auricle. This right here is the left atrium. Let me do one more here. So I'm just snipping apart the pulmonary trunk. And so I'm snipping it, and I'm actually gonna, because I'm cutting it, I'm going to end up cutting into the right ventricle. At least that's my plan. I thought I was. Oh, there it is. So if you look right here, and I've macerated a little bit. Or right here, do you see where my probe is? You see where the tip of the probe is? Maybe. That's one of the cusps of the pulmonary semilunar valve. And this entrance in here, this is the right ventricle. Another one of the cusps is right here. Do you have questions for me? Is there anything in particular you really want to see? I'm going to do one more thing. I'm going to try to cut into the right atrium. And it looks like there's a lot of clotted blood in there, but I'm going to try. So here I just cut through the tricuspid valve. And you can see there's a lot of clotted blood right there. But on this surface right here, there's your pectinate muscles of the right atrium. And right here, that's the superior vena cava. So the sinoatrial node would be about right there. right in this area right here. Questions? I'm going to do one more. I'm going to cut into the left atrium right here. If you look, do you see the two little entries right here and right here? There and right there. Does nobody says anything? Those are the entrances into the pulmonary veins. On the other side, they'd be about right there, right in there. So right there and right there. You can follow them out and they're right there. And right there. It's going to follow somewhere. Anything in particular that you'd like to see?
So my dad had like quadruple bypass surgery, had like every valve in his heart replaced. And they tied off the apex because apparently like it helps with like blood pressure. Like that's just like something new, I guess they're doing. So I guess like if you put the heart all back together and you tie it off and put everything back together, it helps with the pressure, I guess, within the heart. I don't know.
Did they tie it off? Does his heart beat at a faster rate now?
You know what? I don't know. I don't know. I just know that he's almost 2 years out and he's still alive. Because he had 80 to 90% blockages in every valve, every part of the heart. So
I would think that the reason they would do that is partly to allow the heart not to have to contract as hard. If it's what I think it is.
mm-hmm.
But it would also lower the stroke volume because it's going to cut down on the volume of blood that the left ventricle can pump out.
Mm.
And so the heart rate's going to go up too.
Interesting. He's still not all that healthy. Like he's getting a lot of swelling in his ankles and he's on Lasix and stuff. So anyway.
Is the swelling in his ankles worse now than it was before?
Yes.
Because, and I think, is he going into congestive heart failure?
Not that they can tell. I mean, that's not, I don't think so. I mean, maybe, can you live chronically with congestive heart failure?
Oh yeah. Oh yeah.
So he might.
Yeah, my grandpa actually has been living with it for probably the past year.
Wow. How old is your grandfather?
He's in his late 70s.
Yeah, my dad's like 77.
Wow.
Yeah, a lot of people have it, but that's, I think, what we were talking about with your mom earlier about like when the heart is affected and then the lung backs up, you know, all the fluid to on the left side of the heart.
Right.
Basically, that's what CHF is. And then that causes, I guess, like the heart not to like contract as much as it wants to and pump the blood out.
Well, and if it's backing up into the lungs, it's going to back up into the right ventricle.
Yep. And then that's where the swelling, I think, it goes.
Yeah.
because there is not great circulation. So then you get the edema on your legs.
It's just going to keep backing up.
Yep. So to get rid of it, they give them the Lasix so they can pee the water out.
Okay, to get rid of the pressure, bring down the
Right.
pressure, bring down the volume.
Mhm.
We will talk a lot about that when we talk about the urinary system, because that's one of the major jobs of the urinary system is to maintain the blood volume. Other questions?
No,
I
but
will-
I learned from like what you was doing just now.
Yeah.
The my daughter who was born like premature, you
Mhm.
know, she was only 1 pound 12 ounces, so her lungs weren't developed when she was first born, and they had to give her steroids, you know, to shut that fossa ovalis that you just
Yeah.
showed me, which I didn't know where it was, but the steroid that they give to those premature babies so that their lungs develop didn't really work for her, so they had to like go and like shut it. Basically, they had to do a surgery called PDA, and like
What's
had to
PDA?
like ligate it.
Pediatric.
No, PDA is actually patent.
I've heard of it.
PDA, patent that what was it? Patent that oh, I can't think of it, but something patent that something.
Yeah, it actually says patent ductus arteriosus.
So it goes in and it's sewing off a duct.
Yep.
My brother had to have that done. Yeah.
Yeah, when they were like for normal people, for you and I, like when we first take our first breath, it shuts off. That, you know,
Right.
valve will shut off, and then
Right.
the oxygenated and deoxygenated blood doesn't mix up in the heart. But for kids like that, you know, doesn't automatically like shut with their first breath, then they
Right.
have to go back. Well, the first non-invasive thing that they try is first give them steroid, but if it doesn't work and it doesn't automatically shut it for them, then they have to like ligate it
Yeah.
and cause it to like shut down. But she's been great ever since. Like she doesn't have any problem, and she caught up to her age people, but
Thankfully.
they had to do that.
My little sister, who's now she's a lot older now, but she actually was born with a hole between the atria, like approximately round where the foramen ovale, which is the fossa ovalis, was.
Mhm.
And she didn't have it repaired until she was 5 years old. And my mom, if my mom was awake, she'd tell you about it, but she would go through times where she would look regular fleshy colored, and then she'd look blue a second later, because it causes a major intermixing of the oxygenated and the deoxygenated blood. And
Yep.
essentially makes your heart work a lot harder.
Yep.
Wow.
And this is now her. You want to show them your face? That's Delina. She's totally healthy baby now.
Hi.
Say hi.
Oh, she's so pretty.
Thank you.
Wow. Other questions?
No, but that was a great comment. It was great. I
Yeah.
mean,
Yeah.
I don't know if I've ever seen anybody do it that well. Very good. Good job.
Good. I'm glad, because I feel like I kind of slaughtered it a little bit.
No, it's a hard thing to do. I mean, I don't know. I could see everything you were pointing out.
I
Oh,
wish
really?
I could be there so I could play with it.
You know what? That's what I was
Where is
saying.
the butcher shop in East Berlin to get more?
I know.
To try it ourselves.
It's called Wayne Nels. If you look it up, GPS, Wayne Nels. Wayne, like the name Wayne, Wayne, Nell, Nell. And it's Wayne Nels and Sons custom butcher shop. And yeah, so what the reason I learned about them was because one of my students was married to one of the butchers there last year. And she was telling me, she's like, if you wanted to, my husband could get you a bunch of organs. And so like and I was amazed because when I bought the fixed organs, like the fixed heart and so forth, altogether, they probably cost me about $100. And when I picked up these organs at the beginning of the semester, and I got 2 hearts, 2 lungs, 2 kidneys, a little bit of a brain. What else? 2 hearts, 2 kidneys, 2 lungs. I got something else I can't remember. $28 for all of it. And yeah, so I am, and like I told you, my blade that I'm using is just an X-Acto blade that I got from Walmart. And the probe, yes, I finally invested in a probe. The pan that I'm using is actually a kitty litter pan that I got at the dollar store about 2 weeks ago. And the forceps are just for tweezers. I know the student who was married to the butcher, her last name is actually Nell too. But she was saying that her husband was getting her a heart for Valentine, bringing home a pig heart for Valentine's Day for her. So I highly recommend it. Yeah, I was pretty amazed. I mean, I went in there, I ordered it, and then 3 days later, I went back and picked them all up. So highly recommend it. I can't do this at the school. I cannot take in fresh organs to Stevenson because they won't allow me to bring in something from home. Not realizing that it's actually just meat, but they won't let me. So have a wonderful weekend.
You too. Thank you.
Thank you, and you too. Bye-bye.
Bye.
Thank you.
I know you're preoccupied cleaning
Nope.
up the heart.
You're okay.
Did you by any chance see my email? It wasn't until the class had started.
I have not looked at my email yet.
Okay, so yeah,
Listen.
I'm just.
Oh no,
pretty-
you had a fever.
Yeah.
Yeah, I
Yeah,
did.
Okay.
I saw it. I
Okay,
didn't
cool.
get a chance to respond. Are you doing all
Cool.
right?
Yeah. No, but I didn't want to miss too much. I just wanted to make sure. I heard something about sending. Like, did you want me to email
Send me-
address to be?
Send me your, either text it to me or email it to me, your
Okay.
mailing address.
Okay. All right. Yeah, I can do that.
But get feeling better. You and everybody else is sick right now.
Yep. Yeah, it finally happened. I thought I had permanently evaded it, but
Oh,
You have COVID.
I don't know. I took a test yesterday and it was negative, but I've had like a pretty much like a 101 fever. And I don't know, I had chills I was freezing, but I woke up like drenched in sweat. So
Yes. Oh my God. I had that.
yeah, so clearly
Well-
going through it in some way of So I don't know what
Well,
exactly it
it's
is, but
something. Even if it's not COVID, you have something.
Well,
yeah.
yeah, my mom's been running a low grade fever for the last week.
Yeah, it's an experience to say the least.
Are you vaccinated?
Yeah, I have my booster and everything. Like both vaccinations and the booster. I've been pretty on top of like distancing the last 2 years. So this is my entire family pretty much works in healthcare. So like for me to see them, I have to like kind of abide by
Everything that you have
they're
to.
doing. Yeah, like essentially I have to respect it as much as if I did work in healthcare, just because they can't be like exposed. Like so every time I see my family, I have to take tests beforehand and all that. So
Right.
yeah, I don't know. It stinks though, because we have an exam for our CVT class on Monday. So I'm hoping it's not COVID. So I'm gonna take another test tonight and hope that I can rally by Monday.
You know what? I wonder if, I mean, Becky Horn, that's also in this class, has got COVID for the second time.
Mhm.
And I'm wondering if sometimes, because if you're getting all the vaccinations, I'm wondering if you're just dealing with a subdued variant of it that may not be testing positive for you.
Right. That's how I feel too.
Yeah, and I even got like my flu shot too, so I can't imagine it's that. But yeah, I usually work weekends, so now I'm like starting that whole process of trying not to anger my boss, letting him know I'm not feeling too great.
Well, he doesn't want you to come in and give it to everybody.
Yeah, that's very much true.
Terry, we know you're really good at sharing with everybody.
Yeah, but I just wanted to apologize for missing
No,
class.
I understand completely. Don't worry about it.
And it's just I imagine that we covered chapter 21 today.
We
So
covered
lymphatic and
about
immune system.
half of it.
Okay. All right. I just wanted to make sure I was getting started on the smart book and
Okay.
work for that too. Okay.
Yeah. Get feeling better, all right?
Will do. Thank you. Have a good weekend.
You too.
I hope you feel better.
Thank you.
Alyssa or Safa or Zena, do you have any questions for me?
I was just gonna see if you can please show me how to get to that MP1 and 2. I think it was lab or quiz, because I just can't find it for whatever reason. But
Give me 1 second to get my hands out of my gut here.
yep, that's fine. Take your time.
And then I just have one question. Do we have any exercises to do this week? I kind of missed that earlier. I
But
think
the
I was
lab,
like,
so the lab exercise, I think it's 27.
okay.
And that will be due next week on,
And that's on Wiley.
yes.
Okay, I figured out a way how to fix it. I didn't have to call them. I just did it on my mom's computer since she has like a Dell computer, and since I have an Apple product, it just won't let me do it on mine. So I gotta do it on my mom's.
Is it,
basically.
well, what browser are you using?
I used all the browsers on my iPad. I used Safari, I used Chrome, I used Google, and then none of them was working. So
The other possibility is that your browser's corrupted.
yeah, most likely. I can probably try to look into that.
You can re-download it really easily.
Okay.
But I'm gonna go wash my hands. I'll be back. I'm touching the boo-boo. Okay. Give me 1 second. They're cute kids, Zena.
Thank you. They're a handful.
I can guess. I can guess that. All right.
Yes, Tamina. Okay, I'm trying to log in now. Don't you have class? Go to your class to finish up. You're done? Okay, 120.
Let me, so when you're able, share your screen.
Okay. I'm trying to see if that lab exercise 1 and 2 will be, I guess, AMP 1, not 2.
Yeah.
Let me see. Ew. Delina, can you please go to your room? Go to your room. Let me do this. I'm in class, please. Okay. Let me finish up this and then I'll play with you. Okay? Mom. You have 2 iPads. Use the other one that's not dead.
She's busy learning anatomy.
I know. More like distracting me. Okay.
I'm gonna, oh, you know what? I'm gonna stop recording. Give me 1 second here.
Okay.